Is the voice of Indiana County, WCCS 101.1 FM and AM 1160. You can hear Dr. Cyril Wecht either here on the radio this morning or go to our Facebook page and click on the player, and you can listen to him from your computer or device. Dr. Cyril Wecht brought to us this morning by Marcus & Mack, a law firm representing injured people. Dr. Wecht, good morning.
Hi, good morning. I hope you and your family are well.
And you. We're
yes, thank you.
Glad to have you back on the air with us today. So Governor Wolf yesterday with the mask edict across Pennsylvania, and you've had some very strong comments in the past about the way the state is handling the coronavirus pandemic. Once more, he's put an umbrella over the entire state and basically covering everybody up. What do you feel about Governor Wolf's edict yesterday?
Well, I find it extremely puzzling and bothersome. Pennsylvania, we've had some surges here and there in our state. I think some of the southwestern counties where we are, and a little bit over there around in Philadelphia, but I'm not aware of anything significant. Keep this in mind, everybody should. When they talk about how many cases there are, what they should say more correctly and more specifically is how many more people have been tested positive. What I would like to know, what would be meaningful, is how many of those people are ill, how many of them have gone to a doctor, how many of them have had to undergo any kind of treatment, how many of them had to be hospitalized, how many of them remained in the hospital and are seriously ill, and have there been any deaths. That's what counts, not how many new cases there are. In fact, in a way, it's good if there are new positives and people are not sick or have a 2 or 3 day respiratory illness of a mild nature, because then they acquire some immunity. And eventually we move toward what is referred to as herd immunity. I do not understand this edict about everybody wearing a mask at all times. Yesterday we went to a restaurant with some of my family celebrating someone's birthday, and as you know, alcohol is not served. Well, I don't care. I don't drink. That's not a problem. But I want to show you how absurd it is. Mm-hmm. We're talking to the restaurant owner, an old friend, and she says, yes, she could serve me, for example, a Coca-Cola. But if I said, hey, throw in a shot of rum, I want to celebrate tonight or so on, she could not do that. So she can serve the Coke, but she can't pour in a shot of rum into the Coke and think of any other drink concoction. I just want to illustrate my point. So, stand back and look at these things objectively. I don't understand what this business is about everybody wearing a mask at all times. I'm walking, with my wife. We sleep together. We kiss each other. So I have to wear a mask when I'm with my wife. We're outside walking or driving or what? I don't understand. I don't understand.
You have always been big on the science and on the numbers. Let's talk about the numbers and the percentages of people. You mentioned it a moment ago, people who get sick from having coronavirus, people who actually get hospitalized, have to go on a ventilator, the number of people who died. It's not as if those numbers are not readily available to us now, is it?
No, these numbers are available. And what they show, if you look at what scientists of a more objective nature, epidemiologists, are reporting, you will see that for people under the age of 60 who are, just in good health, the mortality rate is 0.1 to maybe 0.3% at the highest. I want to repeat that. People under the age of 60 in good health, 0.1 to 0.3. That's not much different from influenza, from a lot of other illnesses. And they're not paying any attention to this. Look at the universities, and many of them are still withholding specific instructions, information to their students about whether or not they can come back onto campus. I was delighted to read Cornell University's announcement, I think 2 ago. They're bringing students back, and they'll have precautionary measures. Let me make a point here. I'm not telling people mask. If you want to wear a mask, wear a mask. And I'm not telling people not to be sequestered or quarantine themselves if they wish. But don't impose that on the entire society.
Yeah.
You cannot bring civilization, our society, to a standstill. It is ruining lives. And the people who pound their chest, I call them the mask brigade. They say we're doing this to save lives. How about the lives that are being destroyed, the lives that are actually being lost, increased suicides, increased drug abuse cases? How about all the lives that are being destroyed in many ways, financially, domestically, academically, socially? Don't they count?
Yeah. When my background is in farming and dairy farmers in particular. And when a baby would be born, that baby, within a couple of days of being born, it came time to milk, that baby was out in the barn with everybody else, being exposed to all of that environment. Exposure does not necessarily mean a bad thing. It can, but it doesn't necessarily mean a bad thing. We always said those babies that were out in the barn, they had a better immune system than others because they had some exposure to some of those germs.
Yeah, that's a good point. And through the years, as a pathologist, when I think of the thousands of autopsies that I've done on people who had all kinds of infectious diseases, including AIDS and influenza, and I've done a couple of people positive with COVID and so on and so forth, I'm not trying to be brave. I certainly don't think I'm being foolhardy, courageous, or so on. But, you deal with things, and I think that I, probably have acquired some immunity here and there along the way. At least it would appear that way. So, as an example, but I'm very concerned about the millions of college students that can't go back to school. I don't know, here we are in July, whether they are going back to school. I'm concerned the whole world of athletics, the entire world of entertainment, in the domestic situation, people that are living in tight sequestered quarters with one spouse being an abusive person. How does that work out with the other spouse and with the children? And then how about other kinds of social relationships? And then, of course, the financial picture is horrible. 25 to 50% of restaurant owners, they say, will not reopen. And now with this latest ban on alcohol here in Pennsylvania, this definitely will cripple many of them. And then in the legal field, people who have legitimate, important legal matters to pursue cannot do so. Jury trials are not taking place. And then in the medical field, well, I think things may be getting back to a reasonable state of normalcy, but for many months they were saying to people, don't come in unless you have something of an emergency nature. We're not doing any elective procedures. Well, how do you know what is susceptible and necessary, and how do you know that which can be withheld? That's why we do biopsies, to differentiate between a non-malignant tumor and a malignant tumor. And I know of cases where people have paid a heavy price because they had a malignant tumor that grew for another 4 months or so on that could have been diagnosed and treated earlier. So across the board, do you see what is happening to our society? And to think of this continuing for many months, some people talk about for a year or two more. It can't and should not be done. You got to live with it. I'm not saying dangerously so. The people that need to be treated specially, that need to have precautionary measures imposed upon them or voluntarily accepted, fine. The elderly, the disabled, people with chronic respiratory, cardiovascular, hepatic, and renal diseases, people who are obese, people who are diabetic, fine. Absolutely. Focus your attention on them. But don't just come out with a stupid, asinine ruling like Wolf and Levine did yesterday or the day before, whatever, that everybody wears a mask, nobody can be served alcohol. You don't want people, for example, to drink at the bar and be close together, then say that. But if I go into a restaurant and I'm paying $50, $60 for a meal and sitting there with my family, again, I don't care. I'm not speaking personally. I don't drink, so I don't miss anything. That's not the point. But other people are there. They can't have a glass of wine. They can't have a drink while they're enjoying their meal. What is this all about?
Yeah. Well, I think there's a political angle to it that we...
Oh, there's sure. Oh,
yeah.
It's been so politicized. So politicized. Unbelievable. Unbelievable.
All right, we only have a minute left or so with Dr. Cyril Wecht. Dr. Wecht, we've used the term a couple of times, herd immunity. Tell me how it works.
Herd immunity means that a disease of an infectious nature is out there. The contagiousness is understood and accepted, and then people acquire the disease and develop the antibodies to that disease. And then eventually you have a supermajority of people who have the antibodies, and the disease is no longer of a serious nature. And even if it's spread a little bit, not much. And that is what is meant by herd immunity. And that is something I think that we should strive for. Again, recognizing that some people need to have special precautionary measures accepted or even imposed upon them. But herd immunity means that, you just get out there, and all of us have some antibodies, I'm sure, to different kinds of influenza, et cetera. And so should it be now. Look, we've lived through polio, tuberculosis, HIV, AIDS, Ebola, Zika, SARS, and MERS, and we'll live through this. Let people acquire immunity. There are going to be some people that will be seriously ill. There will be some people who will die. In the meantime, the other kinds of deaths and serious disabilities, impositions, and ruinations of lives are being ignored by the people that say, oh boy, if we all wear masks, we'll save lives.
He is Dr. Cyril Wecht. I want to thank you again for coming on and explaining really from a scientific angle exactly what is going on here.
Well, thank you. A pleasure. I want to wish you, your family, and your listeners a very pleasant, enjoyable July 4th weekend, okay?
And yours as well. Have a great weekend.
Thank you. Bye-bye.
It is the...
Thank you. Bye-bye.
It is the...
Thank you.